This is the Chapter 9 overview. Chapter 9 continues the focus on insurance. In this case, the focus is more on health insurance. Health insurance planning should include medical expense insurance and disability income insurance. As usual, the first step is to set your goals and then develop a plan to reach those goals, put your plan into action, check your results, and again, it is a continuous process. Group plans covers most individuals without a physical. Usually they are employer sponsored, and the employer pays part or most of the cost. Major provisions in a health insurance policy. First of all, you have the copayment, the cost sharing in the form of a flat dollar amount you pay, such as $15 per office visit or $10 per prescription. You have the service benefits, entitlement to specific services. And then you have the benefits limit, the maximum dollar amount or maximum number of days in the hospital. The chart here shows what a health insurance plan should include. This is something that you may want to use as a guide. It offers basic coverage for hospital and doctor bills. It provides at least 120 days hospital room and board in full. It provides at least a $1 million lifetime maximum for each family member. It pays at least 80% for out-of-hospital expenses after a yearly deductible of $500 per person or $1,000 per family. It imposes no unreasonable exclusions, limits your out-of-pocket expenses to no more than $3,000 to $5,000 a year, excluding dental, vision care, and prescription costs. Although health insurance plans vary greatly, all plans should have the same basic features. There are different types of health care plans. We just talked about the group plans. There are also the private health care plans, such as that are sometimes group plans as well, health maintenance organizations, or referred to as HMOs, preferred provider organization, PPO, and point of service, which combines the features of HMO and PPO. As you've read in the chapter, you should have learned that some of the differences are that many times you do have to go to your primary care person first and then be referred to specialists, depending on the type of health care plan that you have. Some government health care plans are Medicare, federally funded health insurance program. It covers those age 65 plus and certain disabled persons. It does not cover everything. The patient is liable for the difference. There are 4 parts. Part A is the hospital insurance, Part B is the medical insurance, Part C is the Medicare Advantage plan, and Part D is the prescription drug coverage. Many times Medicare does not cover prescriptions, so many times that has to come from a secondary insurance. The next one is Medicaid. Medical assistance offered to certain low-income individuals and families. It is administered by the state. Typical benefits are physician services, inpatient and outpatient hospital services, lab services, skilled nursing and home health services, prescription drugs, eyeglasses, and preventative care for those under 21. Another type of insurance that you should have read about in this chapter is disability income insurance. Some disability insurance benefits through Social Security if you pay Social Security. Not everyone pays Social Security. You may want to look at other options through your employer. Sometimes there are limitations if you don't sign up at the time of hire and other limitations. Sources of disability income. Workman's comp is one, a disability from an on-the-job accident or illness. Employer plans, they have short or long-term group disability policies. Social Security covers total disability lasting greater than 12 months, and it starts in the 6th month. And private income insurance program supplements other income services and normally provides 40 to 60% of the income. This chapter finishes up with discussing why healthcare costs have risen. Be sure to read the entire chapter. End of the Chapter 9 video.